Can you see facelift scars? The face and neck lift done in one procedure is, to me, one of the best procedures to rejuvenate the mid and lower face. In order to do it effectively, you've got to place some scars. And if we can hide those scars, the drawbacks from a facelift get hidden, and we get the benefits from it: a tighter neck, a tighter jawline, a lifted cheek fat pad, and more angulation of the face without seeing the scars. Where are the scars from a facelift? The scars from a facelift are done in a variable way. The way I like to do them is make the scar around the temporal hair tuft. I don't like to change the position of that hair tuft. In some patients that have the scar come up here from a facelift, the temporal tuft is lifted, and that's a telltale sign of a facelift. So the first scar is around the temporal hair tuft, and if you angulate the scar correctly, hairs grow through the scar and we don't see it. When it comes to the area in front of the ear, I like in women to place this behind the tragus. This is the tragus, the little dangly thing right here. I put it behind that so that our eye has the scar interrupted. And when we see little areas of a scar, we don't really realize it. Then we like to not change the position of the earlobe to the head. Some people have detached earlobes. Some people have attached earlobes. I sometimes ask my patients what they like. And then behind the ear, I try to make this to not change the posterior hairline. If you can do all that, it's very hard for someone to see a scar from a facelift. The person afterwards can wear a ponytail, or if a man, you can wear short hair and not have it be very well seen. In a male, I put the scar instead of behind the tragus, just in front of the tragus, because the male is going to have hair on the flap, and that's going to get moved. And if we move hair back into here, we're going to have to shave almost into our ear canal. How long does it take for facelift scars to fade? If we do all this correctly, we can make it very hard to see any signs from having had a facelift. Facelift scars, even though they heal very well, they don't look perfect immediately. The one in front of the ear looks good very early, but behind the ear takes a little longer. So for women, I tell them to have the idea of stylizing their hair for about 3 or 4 weeks forward and to cover the scars a little bit. Within about a month, the scars should look quite good and quite difficult to see. I love doing facelifts. I think they're a procedure that really rejuvenates the face in a wonderful way. And I think you can do these without changing the hair pattern and making the scars almost unnoticeable. If you want to call me about facelifts, about anything relating to healing, the results, the goals of facelift, I'd love to talk to you. Call or email me or my office at any time. I help patients like you every day, and I'd love to see you in my office. Thanks a lot.